Let us now go to interview and history taking strategies. The topic is taking a health history. The health history lays the foundation for care. It guides the relative emphasis placed on each system in the physical examination and the formulation of differential diagnoses and treatment decisions. A weak foundation places the patient at risk for misdiagnosis and inadequate or erroneous treatment. It also identifies the clinician as one who does not practice within acceptable standards of care, making the clinician vulnerable to legal action. Having the patient participate in developing their health history is a powerful tool for building a partnership between patient and provider. A well-designed, culturally and linguistically appropriate health history form helps to move the patient from passive responder to active collaborator in developing the personal database that will drive future decisions about their care. It also begins the patient education process. The form requires the patient to complete a review of past and current health and to reflect on the potential impact of healthcare behaviors, beliefs, and values upon their health status. Engaging a patient in this reflective process helps to give a sense of ownership over their healthcare data and primes receptivity to future patient education. The ultimate goal of all healthcare is to maximize the health and well-being of the patient. Whether this involves health maintenance and disease prevention or the actual treatment of a medical or surgical condition, many patients will be asked to make major sustained changes to their current behaviors in order to acquire or sustain their desired level of health. Adherence to a therapeutic regimen is influenced by multiple factors, including the patient's perception of the severity of the need or condition and the cost benefits associated with adherence. By actively involving the patient in the development and analysis of a personal health history, the clinician lays the groundwork for active participation in identifying healthcare goals and in designing a culturally congruent plan of care. An ongoing collaborative process supports patient autonomy, enhances adherence, and increases the likelihood of achieving desired clinical outcomes. Here are some tips when conducting the interview and health history. First, demonstrate professional appearance and behavior. Unkempt, overly casual, or inappropriate dress or unprofessional behavior do not inspire confidence. Second is provide for privacy. Health histories contain highly confidential information and should be obtained in settings that maximize the patient's privacy. Third is provide a quiet and non-distracting environment wherever and whenever possible. Unless it is essential to your professional role, it is best to turn off your cell phone and not interrupt the flow of the patient's history. Fourth is address the patient by the appropriate title, be it Mr., Miss, or Mrs. Next is always introduce yourself to a new patient and identify your role. For example, I'm Ms. Rogers, a nurse practitioner. Next, request the patient's permission to conduct the health history. Try to obtain historical data with the patient fully clothed. Clothing is important to a sense of personal integrity and identity. Next is position yourself at the same level as the patient to avoid establishing the provider as being dominant in the relationship. Next is recognize potential biases that may adversely affect your ability to elicit an accurate and complete health history. Observe the patient for any sensory deficits such as hearing or visual loss and adjust your interviewing techniques and positioning accordingly. Next, prioritize information needs to maximize conservation of the patient's physical and emotional resources. Patients in pain or acute stress require special consideration. Next, know and respect the cultural norms and values of individual patients and adjust interviewing techniques. Do not impose cultural norms on the interviewee. If language barriers necessitate using a translator, address the questions to the patient, not the translator, and allow adequate time for the translation and response. Next, ask the patient if it is acceptable if you take brief notes during the interview. Assure the patient that all of the information that is provided will be kept confidential and used as a basis for care decisions. If the information provided by the patient will be used for other purposes, such as to obtain third-party reimbursement, the patient or guardian must be asked to sign a release authorizing approval for these additional uses or privileged healthcare data. Next, use open-ended questions whenever possible to elicit information during the history-taking interview. Do not suggest symptoms or descriptors to the patient or informant, especially in the initial portion of obtaining the history of present illness. Next is help patients to become partners in the caregiving process. Ask about their healthcare goals and expectations about their care. Give the patient adequate time to respond. Do not create a hurried atmosphere, especially when eliciting sensitive information. Next, do not use technical terms or medical jargon. Every health history presents an opportunity for patient education. Give your explanations in language that the patient can comprehend and use. Be an attentive, non-judgmental listener and an alert observer throughout the health history. Do not interrupt prematurely and control an urge to fill every pause or silence with another question. Next, observe nonverbal behaviors throughout the interview, such as significant affective and postural changes. These often occur in areas of the health history that contain sensitive information that requires more in-depth exploration. Next, acknowledge the value of the patient's information through the use of supportive statements during and at the end of the clinical interview. A statement such as, "Mr. Jones, you have provided a very clear picture of your symptoms. This will help us to make much wiser choices about what tests to order." Next is validate your perceptions when the patient has completed telling you a piece of information or expressed a particular healthcare preference. Also, if the interview yields contradictory information, revisit earlier areas of inquiry to check for consistency or response of the patient to clarify your perceptions. And lastly, beware of prematurely cutting off a line of diagnostic inquiry. Although a patient's presenting symptoms may strongly suggest a particular diagnosis, failure to adequately explore alternative explanations may cause the clinician to falsely reject an important differential diagnosis. Thank you so much for your attention.